guidance from the Centers for Disease Control in the United States. It suggests cutting the isolation period for people infected by COVID-19 from 10 days to 5. The change applies to all Americans who test positive for the virus, regardless of vaccination status. After the isolation period is over, the recommendation is for people to continue wearing masks around others, even in their own homes, for another 5 days. It's a recommendation my next guest says could work in Ontario, with some caveats. Raywat Deonandan is an associate professor and epidemiologist at the University of Ottawa. Good morning.
Good morning.
So when this came out, it certainly raised a lot of eyebrows. Why do you think the province of Ontario has decided to review these new guidelines from the U.S.?
I think they've decided to review it for two reasons. One is it's in line with what the commercial sector wants. They want people back at work faster. And also with Omicron, a lot of people are going to get exposed and infected very, very soon, and taking large numbers of people out of society in bulk will cause a lot of chaos. So something needs to be done to reassess the SOPs to see if we can prevent that from happening.
And how do you feel that balances with keeping the public safe?
So I don't like the CDC guidelines in general, but one good thing about it is that they're on board with reducing the time of isolation, which I think we have to consider. The biggest problem with the CDC guidance, well, there are a lot of problems. The biggest one is that they're allowing people back into society without a negative test. I think when you layer on top the negative test, I think things get very, very safe indeed. But the utility here is reducing the isolation period to allow people to get to work faster.
But, 10 days doesn't seem like a lot for someone to kind of get COVID and get over it. Or are you feeling that people may only need to isolate for 4 or 5 days, 6 days?
I think it depends on what the negative test says. So let's say you are 2, 3, 4 days into your post-positive test experience, and you have no symptoms for 2 of those days. Now, for 2 additional days, you test negative on a rapid test. I think at that point, the combination of a sustained asymptomatic status and subsequent negative rapid test is a strong indication that you are not infectious anymore. But that negative test has to be there.
The CDC has said, mask wearing still needs to be very much part of this. Is that not enough to address the concern with regards to testing?
No, it's not enough. And frankly, it's because people wear masks in a sloppy way. They're not talking about what quality of mask they're going to use. Are they going to sleep in the mask? You're sharing unventilated space with your household members. They're going to be exposed at some point. So it's unclear. Now, the CDC guidance is problematic for a number of reasons, and one of them is that they are combining vaccinated with unvaccinated. The vaccinated people are likely to be symptomatic for a small period of time, and they're basing their recommendation on outdated data. It's on pre-Omicron data. So they're saying that you're more likely to be transmitting 1 to 2 days before the onset of symptoms, and about 2 to 3 days after. With Omicron, you're likely to be transmitting after the symptoms arise. So the symptoms happen a day before you start being infectious if you've been vaccinated. So this has to be reassessed a bit. The important part to me is reduce the isolation period, maybe 5 days, sure, why not, but throw in asymptomatic status and 2 negative rat tests.
Quebec's health minister recently announced that some healthcare workers who've tested positive for COVID can remain on the job, and that's to protect hospital capacity in the province. Should Ontario consider that?
Well, weirdly, they've kind of been doing this throughout the entire pandemic. I think it's called working quarantine, where a healthcare worker tests positive. You put them in a mask and put them in a role in the hospital where they're not interacting with people. I don't know how commonly that happens, but it's part of a protocol that exists. So we would do this if we're in a crunch for healthcare workers, and we're probably approaching the point where we're going to feel that kind of crunch. Quebec had a code orange recently due to COVID staffing shortages. So it's not surprising that Quebec is exploring this option. We're going to get there soon in Ontario, I think, because the worst of the wave is coming and the stress on the healthcare system will be felt acutely.
Ontario is also going to start collecting data to differentiate between patients who go to the hospital because of COVID and people who go to the hospital for other reasons and then test positive for COVID. Does that matter?
It does matter. It matters from a PR perspective for sure. One of the pushbacks we get when we try to explain that COVID is serious is people are saying, well, the data is skewed because people are showing up for their broken arms and they happen to have a positive COVID test, and that's being added to the COVID hospitalization data. To take that argument away, we need to differentiate between the two groups. And epidemiologically, it's important to know exactly how many people are being sent to hospital because of COVID to get a sense of what we call the IHR, the infection hospitalization rate. That's a measurement of disease severity. I think this is a good move.
And what do you think that adjustment will mean? Will it mean it's not as bad as we thought, or?
Yeah, it'll probably reduce the estimated hospitalization rate, but I don't think by a lot. I think the hospitals are filling up because of COVID, not incidentally related to COVID.
Raywat, while I have you on the line here, of course, the big talk right now among parents is what's going to happen as far as back to school. So based on the information we have at this moment, what do you think is the best advice here as far as sending kids back to school?
It gives me no joy to say this, but I think school return should be delayed by a week or two or more, and have two reasons for that. The first is administratively, because of the isolation protocols, so many people are going to be exposed very, very quickly that kids are going to be sent home anyway due to quarantine and isolation reasons, and that's going to create such chaos up front. What's the point? The second reason is we're looking at an incredibly high spike in cases happening in Ontario very, very soon. And we have about 1 million kids in Ontario who either aren't vaccinated or can't be vaccinated. That's a large number of naive, susceptible people that might fill our hospitals. Now, not all of them will be hospitalized. A tiny percentage of them will be. But a tiny percent of a large number in a short period of time can be dire. So in New York City, they're seeing the number of kids under 18 hospitalized increased 5-fold in the past week, and half of those cases were kids under 5. And remember, 0% of kids under 5 in Ontario have been vaccinated. So this is why I think we should tread lightly and err on the side of caution.
Let's say the province does decide to open them, the schools. What advice would you give to parents who want to or they have to send their children back to school?
I think if your kid is vaccinated, the probability of anything bad happening to your kid is small. The issue is, will the kid bring back infection to your household? If that's the case, I hope you don't have an immunocompromised or vulnerable person at home. Do symptom checks. If you've got rapid antigen tests, use those to keep your infectious child out of the school system. Use a high-quality mask, an N95 respirator. Get a HEPA filter for your home if you've got one. And just be responsible. Reduce exposures in other ways if school exposures are going to be untoward.
Raywat, thank you very much for your help, not just this morning here, but throughout 2021. Wishing you a Happy New Year.
Oh, thank you so much. My pleasure.